Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Pemphigus and Pemphigoid. Introduction. Pemphigus and Pemphigoid are skin diseases. Pemphigus and Pemphigoid can happen at any age, but they often strike people who are middle-aged or older. In about 1/3 of cases, treatment makes all of the blisters and sores disappear completely. Without treatment, sores can become infected. This can lead to life-threatening complications. This program explains Pemphigus and Pemphigoid. It also discusses symptoms, causes, and treatment of the conditions. Pemphigus and Pemphigoid. Pemphigus and Pemphigoid are autoimmune disorders. Normally, your body's immune system protects you from disease and infection. But if you have an autoimmune disease, your immune system attacks healthy cells in your body by mistake. Antibodies are a part of the immune system. These proteins are made by plasma cells, a type of white blood cell. The antibodies are made in response to an antigen. Each antibody will bind to one specific antigen to help destroy it. Some antibodies destroy antigens. Some make it easier for white blood cells to destroy antigens. With Pemphigus and Pemphigoid, antibodies attack healthy cells in your skin. This causes blisters and sores to form. The main differences between Pemphigus and Pemphigoid are 1. The types of blisters they cause. 2. The locations of the blisters. Pemphigus causes blisters in the epidermis, which is the outer layer of skin. Pemphigoid happens deeper in the skin, where the epidermis meets the layer below. This layer is known as the dermis. Pemphigoid is more common than Pemphigus. It is most common in older adults. Pemphigus is a more serious condition than Pemphigoid. Blisters caused by Pemphigoid do not rupture, so there is less chance of scarring and infection. Pemphigoid may go away even without therapy after a few months or years. Pemphigus and Pemphigoid attacks can be acute or chronic. Acute means that symptoms start or worsen quickly. Chronic means that symptoms persist or go away and come back over a long period of time. Pemphigoid gestationis is a rare form of Pemphigoid. It affects pregnant women in the 2nd or 3rd trimester of their pregnancy or immediately after pregnancy has ended. Pemphigoid gestationis causes blisters and an itchy rash. It usually starts in the abdomen and spreads over the body. Usually the condition heals within a few months after pregnancy, but it may flare up during menstruation. Causes. In most cases, it's unknown what triggers Pemphigus and Pemphigoid. The conditions often appear randomly with no clear cause. Pemphigus does not spread from person to person. It does not appear to be inherited or passed down from family members. Sometimes Pemphigus and Pemphigoid develop as side effects of certain medicines. They may be caused by blood pressure drugs, penicillin, or chelating agents. These types of Pemphigus and Pemphigoid usually go away when the medicine is stopped. Pemphigoid may be caused by ultraviolet light therapy to treat skin conditions. It may also be caused by radiation therapy used to treat cancer.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Symptoms. Pemphigus causes blisters on your skin or mucous membranes, such as in your mouth or on your genitals. The blisters rupture easily. They leave open sores which may ooze and become infected. There are 2 main types of Pemphigus. Pemphigus vulgaris, the most common form. Pemphigus foliaceus. Pemphigus vulgaris usually begins with blisters in your mouth, which then erupt on your skin. Blisters can also break out on the mucous membranes of your genitals. The blisters typically are painful, but they do not itch. Blisters in your mouth or throat may make it hard to swallow and to eat. Pemphigus fallacius usually does not affect mucous membranes. The blisters, which often begin on the face and scalp and later erupt on the chest and back, usually aren't painful. They tend to be crusty and itchy. Pemphigoid causes large fluid-filled blisters. They usually happen on areas of skin that often flex or fold, such as the armpits, lower abdomen, upper thighs. Blisters or sores may also develop in the mouth. Rarely, the mucous membranes of the eyes can be affected. This can cause eye redness, soreness, and discomfort. The large blisters caused by pemphigoid do not easily burst when touched. The fluid inside the blisters is often clear but may contain some blood. The skin around the blisters may appear normal or red. The affected areas of skin can be very itchy. Complications. Skin infections are a possible complication of pemphigus and pemphigoid. Rare forms of pemphigoid that affect the mouth or eye can lead to scarring. Burst blisters can become infected, which can lead to sepsis. Sepsis is an infection in the blood that can be life-threatening. It is more likely to happen in older adults that are in poor health. Symptoms of sepsis include chills and severe shaking, confusion, dizziness and agitation, fever, joint pain, low blood pressure, rapid breathing, rapid heartbeat. Pemphigoid gestationis can cause harm to the affected woman and her unborn baby. It may cause a low volume of amniotic fluid, early labor, lesions or a rash in about 10% of newborns, low birth weight, slow intrauterine growth. A woman affected by pemphigoid gestationis should be monitored by her healthcare provider. Pemphigoid gestationis may come back in future pregnancies. Diagnosis. Blisters can be the symptom of many conditions. Because it is rare, pemphigus can be hard to diagnose. Your healthcare provider will perform a physical exam. He or she also will ask you questions about your medical history. Your healthcare provider may lightly rub a patch of normal skin near the blistered area. If you have pemphigus, the top layers of your skin are likely to fall off. This is called the Nikolsky sign. Your healthcare provider may do a blister biopsy. A biopsy is the removal of cells or tissues for examination. For this test, a piece of tissue from one of the blisters will be removed. It is then examined under a microscope. Certain chemicals may be put on a skin sample. Depending on the way the skin reacts, different types of pemphigus can be diagnosed. Your healthcare provider may also run blood tests. One purpose of these tests is to detect and identify certain antibodies in your blood. The presence of certain antibodies may help a healthcare provider diagnose pemphigus or pemphigoid. Treatment. The goal of treatment is to reduce symptoms and prevent complications. It is generally more effective when it is started as early as possible. Medicines to treat pemphigus and pemphigoid include steroids, which reduce inflammation, drugs that suppress the immune system response, antibiotics, antivirals, and antifungal drugs to treat infections, biological therapies, such as drugs that target white blood cells. If your pemphigus is not too widespread, you can usually stay at home for treatment, but widespread pemphigus may require you to stay in a healthcare facility. At the healthcare facility, you may be given anesthetic mouth lozenges to control pain caused by mouth sores, fluids to replace those lost from oozing sores, intravenous feeding if mouth sores make it too painful to eat, therapeutic plasmapheresis, treatment for infections if they happen. Self-care can ease the symptoms of pemphigus and pemphigoid. It can also help you heal more quickly. Avoid situations in which your skin could be touched, bumped, or injured. Take good care of wounds to prevent infections and scarring. Use talcum powder on your sheets to keep oozing skin from sticking. Treat sores and blisters with soothing or drying lotions or wet dressings. Avoid spicy or acidic foods, as well as those containing garlic, onions, or leeks. These foods can irritate or even trigger blisters. Avoid hard or crunchy foods if you have blisters in your mouth. Minimize exposure to sunlight. If you have blisters in your mouth, it may be difficult to brush your teeth properly. Ask your dentist what you can do to protect your oral health. In about 1/3 of cases, treatment makes all of the blisters and sores disappear completely. Some people must continue to take a lower dose of the medicines for the rest of their life, or their signs and symptoms will return.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Pemphigus and Pemphigoid are autoimmune disorders. Antibodies attack healthy cells in your skin. This causes blisters and sores to form. Pemphigus causes blisters in the epidermis, which is the outer layer of skin. Pemphigoid happens deeper in the skin, where the epidermis meets the layer below. This layer is known as the dermis. Pemphigoid is more common than pemphigus. It is most common in older adults. Pemphigus is a more serious condition than pemphigoid. Blisters caused by pemphigoid do not rupture, so there is less chance of scarring and infection. Pemphigoid may go away even without therapy after a few months or years. In most cases, it's unknown what triggers pemphigus and pemphigoid. Skin infections are a possible complication of pemphigus and pemphigoid. Rare forms of pemphigoid that affect the mouth or eye can lead to scarring. If burst blisters become infected, it can lead to sepsis. Sepsis is an infection that can be life-threatening.
Thank you for using Explain.